Cubital tunnel is the second most common compressive neuropathy in the upper extremity we tend to see in the office. This is irritation of the ulnar nerve or funny bone nerve at the level of the inside of the elbow. Usual complaints that patients have is either intermittent or constant numbness and tingling that affects the ring and small finger. This can be constant or intermittent. At times it can wake the patient up at night, or they can notice it if they're driving the car, leaning on the inside of the elbow. At times there can be electric-like sensations that run from the inside of the elbow to the ring and small finger, or from the inside of the elbow up the arm into the armpit. Occasionally there's weakness and clumsiness associated with this. It becomes hard to do fine motor activities like trying to put your shirt on, put contact lens in, put jewelry on. The diagnosis is confirmed on physical exam and history and confirmed by nerve test. Depending on the duration of the symptoms, severity of the symptoms, whether there is any muscle wasting associated with this problem will determine the treatment. Usually more mild cases can be treated conservatively by wearing an elbow pad in the daytime, avoiding repetitive hyperflexion to the affected elbow, or leaning on the inside of the elbow. In addition, if you're driving the car, you need to avoid leaning on the console or the elbow pad. If you're using the computer, you need to keep your elbow straight rather than bent. And at night, you need to avoid sleeping with your elbow hyperflexed. You need to avoid sleeping on your back with your arms over your head, or on your stomach with your arms over your head. This usually reduces the protracted flexion position of the elbow, which reduces the compression. If conservative measures fail to control the symptoms, then surgical release is warranted, which is effective, but not as effective in immediately reducing the symptoms as with carpal tunnel. The etiology of both carpal tunnel and cubital tunnel is idiopathic. That is, there's no specific cause, yet carpal tunnel and cubital tunnel could be a little more prominent in patients that have diabetes, rheumatoid arthritis, thyroid disorders.